Hello, everyone, and welcome to Evalu8, Riverside Insight's first ever clinical conference. If you have joined us either Monday or yesterday, welcome back. And if this is your first time joining us, welcome. We have a great week of sessions and really appreciate you taking the time out of your very busy schedules to join us for some fabulous professional learning. My name is Sarah Holman, and I am the Clinical Product Marketing Director here at Riverside Insights. I'd like to personally thank you for joining us for our first session of Day 3, Beyond Eligibility, How Do I Know If What I'm Doing Is Working? For this session, I'm pleased to introduce Dr. Catherine Perkins. Dr. Perkins is a professor in the Department of Counseling and Psychological Services at Georgia State University, the coordinator of the Educational Specialist Program in School Psychology, and a research fellow with the Center for Research on School Safety, School Climate, and Classroom Management. Dr. Perkins received her doctorate from Georgia State University with a concentration in school psychology. Areas of specialization include early childhood development, developmental neuropsychology, biopsychology, and social emotional development of children and adolescents. Dr. Perkins has been a practicing school psychologist in the state of Georgia for over 30 years and holds certifications at the doctoral level both as a school psychologist and school leader. She has worked in the public school setting as a paraprofessional, a school psychologist, and later as an administrator. Dr. Perkins is a licensed psychologist in the state of Georgia and a member of the International School Psychology Association, the National Association of School Psychologists, and the Georgia Association of School Psychologists. She currently serves on the GASP Executive Board, the NASP Leadership Development Committee, and represents NASP as the Secretary of the National Joint Committee on Learning Disabilities. During the presentation, please leave any questions you may have in the Q&A box. A recording of today's presentation and certificate of attendance will be sent to all registrants by the end of next week. And now I will pass it off to Dr. Perkins to get us started.
Good afternoon. What a great commitment. I appreciate everybody joining today. So this is a topic that I'm particularly enamored with. I think a lot of times we do assessments and we spend an enormous amount of time working with children and collecting data, and not as much time really figuring out what that data can tell us beyond the eligibility criteria that we're trying to assess. So I'm excited to be talking to you today about a couple of opportunities that we have with the Battelle Developmental Inventory to go beyond eligibility and look at how to use the data that we collect for program planning and intervention planning. So our professional development learning objectives today are that you would be able to understand some of the levels of interpretive data that are offered to you with the Battelle, that you would have some clinical understanding of the utility of the Relative Developmental Index, that you would have a clinical understanding of the utility of the change sensitive score, that you would have a little bit of a sense of how those scores are derived within the evaluation context, and then we will talk a little bit about how to link the performance to recommendations you might make for the children that you're working with. So for those of you who are not particularly familiar with the BDI-3, the Battelle Developmental Inventory was first developed in 1973 at the Battelle Memorial Institute in Columbus. So it has a long history and has been well vetted in the profession. It's based on the concept of developmental milestones. So it covers 5 broad developmental domains: adaptive, social, emotional, communication, motor, and cognitive. Within each of those domains, there are subdomains. For example, the adaptive domain has a self-care and personal responsibility subdomain. The social emotional domain has an adult interaction, a peer interaction, self-concept, and social role subdomains. Communication domain has receptive communication and expressive communication subdomains. The motor domain has a gross motor, fine motor, and perceptual motor subdomains, and the cognitive domain has attention and memory, reasoning and academic skills, and perception and concepts. The typical uses of this tool are what you might be accustomed to with many different types of tools, but For the BDI-3, it's typically used to highlight areas of strength and concern regarding an individual child's development. It's used to evaluate eligibility for services, to determine the functioning level, to monitor developmental progress, and to inform planning and instruction. So the BDI-3 is an individually administered, norm referenced, and standardized tool. So we're talking about performance of a given child when we're talking about the BDI-3. With this tool, there's a range of interpretive information that we derive. So there's qualitative, informal, or error analysis that we can derive from looking at individual items and how the child responded for individual items. There's our test session observations, and all of this is useful for instructional planning and behavioral intervention. And then there's level 2, which is our level of development and where we monitor our growth and progress. And that would include age equivalent scores and change sensitive scores, which I'll be talking about in just a moment. Level 3 is our level of proficiency. And that's the relative proficiency index, and I'll be talking to you about that. Level 4 is the relative standing in the group, which is our rank ordering for percentile ranks and standard scores and scale scores. So what most evaluators are familiar with is standard scores and scale scores, because those are the scores that we typically use when we are talking about eligibility. What most folks are less familiar with is the relative developmental index and our change sensitive scores. So I'm going to review some information about standard scores, but I'm going to spend more time talking about the relative developmental index and the change sensitive scores. So just if you hearken back to your undergrad course in test and measurement or your graduate level course in statistics, you'll recall that all of our normative tests use the concept of the normal curve that kind of undergirds everything that we talk about, particularly when we're talking about norm reference scores. So our norm reference scores are going to be our standard scores, our developmental quotients, and our percentile ranks. So for a test like the TEL developmental inventory, our big developmental quotients have a mean of 100 and a standard deviation of 15. Our scale scores, which is our subdomain scores, have a mean of 10 and a standard deviation of 3. And they all, and our subdomain scores fall on the same kind of normal curve as we see here. It's just instead of the mean being 100, the mean's 10, and then the standard deviation is 3. So you would have 7 to 13 would be +1 and -1 standard deviations from the mean. What you see at the bottom is our percentile ranks. So whereas standard scores have standard deviations and have equal distances between the standard deviations, you'll notice that our percentile ranks don't have that same property within them. So percentile ranks, just as a refresher, range from a score of 1 to a score of 100, and they're ranked. It's literally a ranking, with 50 being at the midline. So you'll notice that percentile ranks kind of group in the middle, and then they get more spread out at each of the ends of the continuum. So when we're looking at peer comparison or scores of relative standing related to the norm group, then we're looking at comparing our child's performance to the performance of same age peers. So we're talking about our standard scores and our percentile ranks, and our scale scores as well. So on the BDI-3, this is just an example of what the printout looks like if you're getting the printout from the computer. And so you'll notice that there's a scale score for the domain. This is the adaptive domain, just as an example, that has a developmental quotient of 100. So this particular student that's in this example has a developmental quotient of 100, a percentile rank of 50, and the confidence interval of 93 to 107. So if I were to re-administer this tool 100 times, I would expect their true score to fall between a 93 and 107, 95 out of those 100 times. That's what that's telling us. So this all lines up just what we would expect it to be. So the student score is right at the mean, the percentile ranks at 50. And then also you'll notice that the standard scores are right at the mean of the scale score distribution. So you'll notice these are our scale scores, and you notice they're at 10, which is right at the mean for the scale score distribution. Percentile ranks, as I showed you earlier, if the developmental quotient is 100 at the mean, the percentile rank is going to be right at a 50. And the same is true for our scale scores for our subdomains. The mean is going to be right at the middle. So those are probably scores that most of you are familiar with. Those are the kind of scores that we have for all of our major individually administered norm reference tests, right? So we have those standard scores, scale scores, and percentile ranks. And typically that's what we're using when we are determining eligibility based on some state criteria. What many people, when I do presentations across the country and train people to use the Patel Developmental Inventory, most of the people that I work with are using the tool primarily for eligibility, and consequently they don't have a good understanding of what the relative developmental index is and what the change sensitive score is. And so I want to focus a little bit of our time today on these two particular scores, what they mean and how they can be useful for you when you've collected your data and determined, what the next steps are for the child that you're working with. So the Relative Developmental Index provides a criterion reference index of a child's proficiency or functionality within any given subdomain topic area that you're assessing. So it compares the child's proficiency to that of average age or grade mates, and it'll predict the level of success on similar tasks. And so it shows the actual distance from average. So to understand the Relative Developmental Index, it's expressed as a fraction with the denominator fixed at 90, and the numerator indicates the child's proficiency on that task. So if you think about like the Snellen vision chart, many of you may have had your vision tested at some point or time. And so with the Snellen chart, what I know is that 20/20 vision is kind of what we think of as normal or typical vision, right? And so if I go in and have my vision assessed and I have 20/20 vision, then what I know is that I can see at 20 feet what a person with normal vision can see at 20 feet. If I go in and my vision is 20/100, then I can see at 20 feet what a typical normal vision would be at 100 feet, which means I can't see very well. So for a relative developmental index, it's the same kind of concept. So the relative developmental index is weighted with a denominator of 90. And so it ranges, scores range from 0/90 to 100/90. So if the child has a score of 90/90, then that's telling us that they have average proficiency and average development on whatever that task is that we're looking at. If they have scores that are lower than 90/90, then that's telling us their developmental level for that task is not consistent with that of their peers. So relative developmental indexes are particularly helpful if you're working with a child in any kind of early intervention setting, whether it's you're delivering services within the home setting, or you're delivering services within a Head Start setting, or within a preschool setting, or within a school-based service provider setting. Teachers really and interventionists really like having this information because it explains why a child might not look that terribly bad based on their standard scores. Like their standard scores could be right at 1 standard deviation below the mean, and that would not qualify them for services. Yet what the interventionist knows is that the child's not, their proficiency isn't what the proficiency of other kids of the same developmental level and age would be. And so if I have a score of roughly 96 to 100 over 90, then what I know is those are tasks that the child has completely mastered. Those are things that would receive a score of 2 on our scoring of the BDI, right? And so that would translate into a 96 over 90 to roughly 100 over 90. If the child has a relative developmental index of 76 over 90 to 95 over 90, that would be where we would expect them to have like emerging skills. They've got some ability to perform that task, but it's not consistent, or they need a certain level of support to be able to do the task successfully. And then anything below a 75, we think of as being kind of in the frustration range, particularly if it's a task where it's an instructional task. That's the level where the child's going to need considerable support and structure and scaffolding to be able to get them from that level up to the proficiency level that all the rest of their peer mates would have for whatever that particular skill is. So the way we would talk about these kind of scores when we're thinking about them and talking to parents and interventionists, these are some sample statements. So I'll just read it out loud because I don't know what everybody's, if you can read the slides, but Sam's relative developmental index of 21 over 90 on the expressive communication subdomain indicates that on similar tasks in which the average 4-year-old would demonstrate 90% proficiency, Sam would demonstrate 21% proficiency. Sam's expressive communication ability is very limited. So a 21 over 90, again, going back to our descriptors, that would be in the frustration range. And we've all worked with young children who have limited expressive language, who get really frustrated when they can't communicate what they want or what they need. And that would be consistent with a score like this. Another example statement would be, although Nicholas's standard score on the problem-solving subdomain was within the average range for 5-year-olds, his overall relative developmental index of 45 over 90 indicates that he will have considerably more difficulty than most of his age peers when faced with tasks requiring novel problem-solving ability. It's the same kind of statement and comparison. So as I said, the 90 is our grounding number, and 27 in this example would be the proficiency level. So when we look at what the printout from the Riverside score, then we can see that for this example that we were looking at previously, the developmental quotient is 100, which is right at the mean. So the percentile rank is going to be at the 50th percentile. 50% of the norm group had a score at this level or lower. The scale score is a score of 10, which is right at the mean. The percentile rank is at the 50, which is right what we would expect. And the relative developmental index in this example for self-care is a 91 over 90, and for personal responsibility is a 90 over 90. So the relative developmental index for the domain for adaptive is 90/90, but there's a little bit of additional development and strength in the self-care area for this particular child. If we're looking under communication, and we're going to look at what the relative developmental index looks like for this particular individual, we'll see that, just pulling out as an example, in the cognitive arena, this is just another example where the relative developmental index for this child for attention and memory, which the slides kind of cut off, but for attention and memory for this particular child, the relative developmental index is a 21/90. So that would let us know that for this particular child, they're going to retain about 21% proficiency, what other children of the same age and developmental level are retaining with 90% proficiency. So the teacher's going to notice that right away when they're doing intervention. Another score, so that's the kind of the relative developmental index. Give you an idea about what that is. So the second score that I wanted to spend a little bit of time talking about is the change sensitive score. So the change sensitive score is a score that's criterion based. So the relative developmental index is more curriculum based. It's based on the curriculum of the tool. So if you think of the Battelle Developmental Inventory, all of the items within each of the subdomains could be considered a curriculum for that subdomain. So the relative developmental index is kind of a curriculum-based measure because it's kind of based on that content that is actually embedded within the text. The change-sensitive score is more criterion-based. So the change-sensitive score has as its benchmark a set criterion for an average developing student or child in the norm sample at 3 years of age. And so the change sensitive score is for every child, every item the child can do today that they couldn't do yesterday, their score goes up. So when we think about monitoring progress over time, the change sensitive score is the one that we're going to be looking at for monitoring progress over time. So typically norm reference tests like the BDI or other norm reference tools that we're familiar with, they're not designed to monitor progress. So there are some tools that's their whole purpose is to monitor progress. The BDI is designed to look at a range of different things. But fortunately for us, because we have this curriculum and criterion reference component to the BDI, we have additional score options that you don't see in most norm reference tests. So the change sensitive score is one of those additional options, just like the relative developmental index is one of those additional options. So the change sensitive score, as I said, is sensitive to minimal changes in performance. It's literally everything I can do today that I couldn't do yesterday when I was assessed. If I was assessed again, that score will go up. So this is a score we want to be using if we're looking at documenting progress over time. So if you're doing annual evaluations, for example, and many of you who work with young children, if you're doing annual evaluations and you're administering the Battelle, for example, once a year, every fall or every spring. Oftentimes what we see with young children is that the standard scores will stay the same, or they could even look worse because though the child is developing and though we're doing good intervention work, what's happening is standard scores take rate of acquisition into consideration. So for not change sensitive scores, standard scores take rate of acquisition into consideration. So if my child is developing, but they're not developing at the same rate or speed as typically developing children are, then it's possible that those typically developing children kind of pull, boy, I can't talk today, sorry y'all, pull further and further ahead. And so my standard score, even though the child's made growth and progress, my standard score and my developmental quotient can actually look a little worse a year after intervention. That's not going to happen if I'm looking at the change sensitive score. So I can say to parents with the change sensitive score, I can compare change sensitive scores from a year ago to change sensitive scores for this evaluation, and I'll be able to see the progress the child has made, even though their standard scores may not have moved at all, because their rate of development is not keeping up with the same pace as typically developing peers. So let's see, where are we? Okay, so with a change sensitive score, I can document growth even if the child remains shorter than average. This is just an example. So the child may not catch up with their peers, but I can still document the growth that they're making with the change sensitive score. So this is just an example of what a change sensitive score can look like relative to a standard score. So this is just an example of what I was saying. So if I assess a child at age 2 years, 3 months on adult interaction, and they get a change sensitive score of 462, a standard score of 84, and they're at the 14th percentile, and I assess them again at 2 years, 9 months, and they get a change sensitive score of 488. That's an increase of 26 points. And I can actually go into the tool and tell the parent, I can run the report to the family, and I can show what items the child is able to do now that they were not able to do in the previous evaluation. And that's super helpful for family members to be able to see, for parents to be able to see. So this is what a change sensitive score looks like on the report printout. It's in that far column. And this is what it would look like if I was running a longitudinal evaluation where I was comparing, for example, attention and memory, reasoning and academic skills, and perception and concept. So if I'm in the cognitive domain and I'm looking at these 3 subdomains, in this example, I evaluated the child the first time on September 25th in 2014 as an entry evaluation, and then I evaluated them again at the end of the academic year on April 10th in 2015. And you can see the increase in attention and memory, the increase in reasoning and academic skills, and a lesser increase, but still an increase in perception and concepts by running this longitudinal kind of report. So all of these reports and all of this data is yours to access within Riverside Score. So the thing you want to remember is the purpose of each of the scores that you're looking at. You're collecting an enormous amount of data. And so you want to keep in mind the purpose of each type of score. They all tell you something different about the child that you're working with. And so to get the most out of your evaluations, you want to be accessing all of that information that's available to you once you collect the data. Okay, let's talk a little bit. Once you collect all these scores and once you have all this information, what are you going to do with it? So, you know, we've spent a significant amount of time working with a child, talking to the parents, collecting information so that we can have an accurate picture of this individual child and their development. How am I going to use all of that information? So let's look at a child profile. and look at how we might move forward with an evaluation. So this is Fernando. Fernando's a 16-month-old Latino male who was referred for an evaluation due to concerns about overall development. So he was initially evaluated for early intervention services using the Adaptive Behavior Assessment System, the ABAS. And when that evaluation was given, he had extremely low performance in his general adaptive composite. So the team decided to go in and look at the BDI-3 and see if there were any strengths or weaker areas that they wanted to explore a little deeper. So, excuse me, let me go back. Okay. So when we gave Fernando the entire BDI-3, what we found was a developmental quotient of 73 with a percentile rank at the 4th percentile. So only 4% of the norm group had a score this low or lower. So our little buddy Fernando is down in a significant concern range for us, right? So if I look at the developmental quotients for each of the domain areas, he had an 85 in adaptive, a 79 in social emotional, a 76 in communication, a 79 in motor, and an 80 in cognitive, which kind of came up with this overall composite of 73. So 2 areas of concern or 2 areas of relative strength would be his adaptive and his cognitive. And then all of the 3 in the middle, social, emotional, communication, and motor, are all somewhat weaker. But these 2 areas might be areas that could be leveraged. It's certainly the fact that cognitive and adaptive hang together is not surprising. That's kind of typical. It's what we would expect. And so we're hopeful that we can leverage these kind of somewhat elevated strengths to compensate for some of the areas that he has more challenges with. So these areas would be in the significantly below what's expected and would be characterized as mild developmental delay areas for him with this tool. So if we're looking overall at his adaptive behavior, and we're going to get away from standard scores and we're going to look at percentile ranks, age equivalents, and most importantly, at the relative developmental index, what we can see is that for adaptive, for self-care, for example, Fernando can do activities related to self-care with 42% proficiency relative to what other children of the same age can do with 90% proficiency. So compared to other children his age, he can eat semi-solid food when it's placed in his mouth. His ability to bite through soft food is emerging. He's not yet able to feed himself bite-sized pieces of food or participate in any dressing activities. In terms of social emotional, overall, you know, he's got adult interaction and self-concept and social role. Adult interaction, he has his relative developmental index is a 55 over a 90. And then self-concept and social role is a 61 over 90. So this is a youngster that may not have learned how to rely on the adults around him. And so he reacts to positive adult attention and the withdrawal of attention, and he can explore adult facial features, and he's showing emerging skill in expressing enjoyment or preferences for certain things and activities, but he's not yet able to discriminate between familiar and unfamiliar people. So that's obviously a concern. He has awareness of his body parts, but he's not yet able to communicate positive and negative emotions. So some of those things in the social emotional arena, he has not developed yet. And then when we look at communication, again, where the overall relative developmental index is a 27 out of 90, so communication is a huge area of concern for this particular youngster. For receptive communication, we have a 34 over 90, and for expressive, a 21 over 90. So if you're familiar with the BDI, this is concerning because many of the items on the tool require a verbal response, and most of the items require an understanding of the directions. And so it's hard to know whether how accurate these our assessment is if his communication abilities are this low. And then for motor, again, motor is for the overall area. He has a relative developmental index of 37 over 90, with gross motor 47 over 90 and fine motor 27 over 90. So he's not yet walking completely, and his fine motor skills are delayed. So he could bang an object on a table and retrieve a small object kind of by raking it with his fingers. And he was showing some emerging skill with transferring an object from one hand to the other, but he can't yet remove forms from a form board or pick up a small object using the pincer grasp. So that kind of gives you an idea of where those skills are. And then cognitive abilities are actually somewhat, you know, as with adaptive, as I said earlier, these are getting closer. They're still concerning, but he has a 50 over 90 overall for his cognitive ability. So attention and memory, he shows awareness of new situations and can inconsistently imitate simple facial gestures, but he's not yet able to do things like match a circle, a square, or a triangle. So those concepts he hasn't gotten firmly embedded. So when we look at these kinds of data for Fernando, the team made the decision to do, you know, he clearly qualifies for early intervention services. And in particular, the team wanted to focus on, as I said, speech and language, because his communication skills would be concerning, particularly given that so much of learning involves communication. So we wanted to intervene with communication pretty intensely. And then the other area was occupational therapy. So he was referred for speech and language evaluation and for an occupational therapy evaluation. In addition, the team requested parent training because they felt like the parent training would be provided to assist in working on skills at home, because he obviously would benefit from some intensive intervention. So the hope was that whatever's done specifically by interventionists could be reinforced in the home setting on an ongoing basis. And then the recommendation was also for frequent service plan reviews, because we're anticipating that he's going to make progress pretty quickly once he has this kind of intensive intervention. So what you can see from this example is that with this tool and with the range of information that we can garner from this tool, we can plan a pretty comprehensive individual intervention for this child. So the long-term goals that we select can come from domains can provide the broad goals, and subdomains can can provide the more specific goals. And then for our short-term objectives, we can use the individual tasks within the identified subdomains and select all the items where Fernando received like a 0 or a 1, items that are not yet evident or that are emerging. And then for the evaluation criteria is actually embedded within the individual task on the BDI. And the instructional materials also are identified in the individual task. So I usually tell people, I'm not suggesting that you take your test kit and you teach from the test kit, but those are the kinds of activities and the kinds of items that you can use to intervene when you're going to address the skills. So in this way, we link our assessment process becomes a real and living process where we're linking our assessment to curriculums and supports for intervention. So it allows us to monitor the child's progress using the change sensitive score. It allows us to guide the scope and sequence of teaching objectives, provides a basis for communicating with parents, facilitates the diagnosis and treatment of children with special needs, and helps us monitor the effectiveness of intervention activities and programs, as well as contributing to teachers and schools' accountability for students' learning. I know as an interventionist myself, that's probably the one thing that I think I see the most often is parents saying, well, you told me this was going to help my child, and when I'm looking at these numbers, it doesn't look like they've made progress. So I really feel like if we look at all of the data we collect with this tool, we can have data to support the fact that the child's made progress. We just have to branch away from standard scores, scale scores, and percentile ranks. We've got to branch a little further into scores like our change sensitive scores. Okay, so we've got a little time left for questions. The last thing I would mention before we dive into questions is a couple of things. Everything I talked about in the past 40 minutes or so, everything I've talked about can be found in the examiner's manual. So I get accused of being an examiner's manual thumper, and I absolutely am. And so everything we talked about is in the examiner's manual. In particular, chapter 5 has a lot of information on interpretation and the levels of interpretation. And on pages, let's see, I wrote it down, 23 and 24 is where you'll find some specific information about the relative developmental index and change sensitive scores. The other thing I would mention when we're talking about monitoring progress is oftentimes people will ask me, how frequently can I give the Battelle developmental inventory? Because many of our norm reference tools, generally speaking, we think of giving them like once a year, you know, with about a 10 to 12 months difference between time 1 and time 2. Because of the nature of the Battelle and because we actually collect data using multiple different sources of data, the manual says we can use the Battelle closer to 6 months. 3 to 6 months is actually what it says specifically. I would kind of, 3 months, you may not see as much progress. 6 months, you probably will see a lot of progress because of the rapid development of children in this age range. So that just kind of gives you a ballpark about that piece of it. And that information, if you ever are looking for that information in the examiner's manual, is back in the very back where it's talking about the reliability of the tool. So if you go into the section of the manual that's talking about reliability, you'll see that language where it tells you that you can, because of the nature of the tool, you can actually give it closer to 3 to 6 months, every 6 months in that range, as opposed to annually, which we find with many different tests. Okay, I think that's it for me, Sarah.
Okay, So we did have a few questions come in. Going back to Fernando, there is a question about his social skills, and I'm assuming that means play skills, not pay skills. So can you elaborate a little bit on those particular areas of development for Fernando?
Yes, let me see if I can get back to that slide real quick. So for social emotional, and let me see if I can find. So because of his age, we don't have peer interaction for this child. He wasn't given the peer interaction subdomain. And so we have very little information about like interactive play versus parallel play and those kinds of things for this particular child. My sense of it is that with the low communication ability, that would be challenging for him.
That is probably what the question stemmed from, that administration of the peer interaction subdomain.
Yeah.
So
right.
Excellent.
Right.
There is another question about the BDI as it can be used as a progress monitoring tool. Would parental written consent need to be received prior to each administration still? So if you're using it as more of a pre, post, or yearly progress monitoring tool, how does that fit in with the parental consent component?
Yeah, that's a great question. So usually organizations develop their own protocols for how they're going to handle that. I've consulted with a couple of different agencies around using it for pre and post. And typically what they do is they have a separate, once the child starts receiving services, they just have some kind of blanket statement about ongoing progress monitoring, and that they'll be following up with ongoing evaluations of the child's progress that can include these things. And then there'll just be a listing of, observation, monthly service plan review, and then, 6-month review using the Battelle or something like that. So there'll be just kind of a part of the intervention plan has written within it how frequently they're going to review progress with this particular tool, so that when the parent signs that intervention plan, they're also signing for how they're evaluating the progress. Does that make sense? That's what I've seen several agencies do.
Yes, it's probably location specific in a lot of ways.
Absolutely.
There aren't any other questions, but there is a thank you for being a thumper for I'm assuming for the manual, because it helps to hear it verbally rather than having to read it. So yes, I'm going to second your passion for the examiner's manual, but I recognize that they are a cumbersome thing to sort of digest. So thank you very much for making it more consumable.
Yeah, absolutely. I know I do really preach the examiner's manual. And so that's, when people ask me questions or when I have questions, that's where I go. Like I go back to the examiner's manual. So that's where you find most answers to all of your questions can be found. And this just happens to be a really good manual. I will say that, with the BDI-3, they've pulled out all of the norms tables. So it's not quite as thick as the BDI-2 manual was. It's a little easier to kind of carry around. So I find it easier to work with because of that, because it doesn't have all that big section of norms in the back. But it really is, I teach students in my graduate program to administer and score and interpret a range of tools. This is one of the best examiner's manuals that I personally have ever reviewed. So I'm happy to endorse it.
Excellent, excellent. We do have a question about the age range for the BDI. Just want to reiterate that.
Okay, it's ages from 0 to 7 years, 11 months. I didn't really go into much of an introduction about the tool, but there's a range of webinars and training opportunities that have been created around this tool. And if you aren't familiar with the tool itself, the BDI has been adopted by 16 states as the early childhood intervention tool for that state. And then other states have it listed on a menu of options. So there are a lot of training opportunities for the BDI. So if it's not a tool you're familiar with, I encourage you to go to the website for the publisher and see what opportunities there are to get more training on this tool. I know there's some online kind of short, brief training opportunities.
Excellent. So I don't see any additional questions, but I do have one. I mean, if you think about the Relative Developmental Index as sort of the counterpart to the Relative Proficiency Index on the WJ, I have found, and I'd be curious to see if this is your experience too, on how that score really resonates with parents and teachers and the understanding of the kiddos in a way that maybe the standard score doesn't. So is that your experience as well, that parents, that score better describes the kiddo that they see?
Well, it's interesting because parents often don't have a frame of reference, right? So parents may or may not see, depending on the degree of delay, parents may or may not see the significance of a delay if they're first-time parents, for example. If there aren't any other children in the home, they may not even recognize for a while the delay that their child is experiencing. Interventionists, teachers, daycare workers, they absolutely prefer the Relative Developmental Index is the preferred numerical score because it gives them a very concrete sense of how the child's going to fit in the classroom. So if you're working with a group of early childhood children, that score says to you, okay, everybody else in my little Head Start class is going to look like this when we're talking about fine motor tasks. This child's going to look like this. And it gives you a really quick indicator of the level of support you're going to have to provide. It also gives you a really quick indicator of what kind of things that you're planning to do in the classroom this child might struggle with and that you might get kind of a frustration response from, right? So if I'm doing intervention in a group setting, the Relative Developmental Index helps me prepare and prevent like meltdowns, in a group because the child either doesn't understand or needs additional help and support around whatever task it is that the group's doing. So I definitely see that. I think for parents, it's helpful as well, for sure, to your point. I'm just not sure if they're not working with their child in a group, it may not be as meaningful as it is for a teacher who's working with groups of children, if that makes sense.
Absolutely. There is another related question to the RDI. Are there qualitative sort of descriptors associated with that score? She said, may have missed this, but would the RDI break up the score range in delayed, emerging, and proficient?
Delayed, emerging, and proficient. I'm sorry, I missed that last part of it.
So does the RDI break up into ranges of delayed, emerging, and proficient?
Well, the manual doesn't have that in there. So that's what I can say. Now, if you run the reports, there's still, Sarah, you may be able to speak to this more than I can because I haven't seen the latest reports that have been loaded into the platform. Do you know if there are qualitative descriptors for the RDI in the platform?
Not offhand, but I can certainly follow up on that.
Yeah, because I'm not even sure. I know they're continuing to update the platform with different report options. I have not seen descriptors for the RDI score other than what I posted in this PowerPoint. But that's mostly coming from some previous stuff related to the relative proficiency index with the WJ.
That is a very good question, and we will investigate and get back to you.
Yes. Yeah, I'd be curious to know that too. I haven't seen it. It's not in the manual.
Okay, great. Well, it looks like there aren't any other questions, so I am just going to take this opportunity to thank you for the excellent information and for joining us, all of our participants. We are excited to get going with our session number 2 of day 3 of Evaluate. And if you will just give us just a second to make the transition, we will start shortly.